I made the wrong call this morning. I woke up, my neck was tight and sore. I trained Jiu-Jitsu anyway, and now it's worse. The interesting thing is it's not even my neck. That's the problem. I'm going to take you through three things. First, what I did wrong and why even a smart person would make that call. Second, the assessment process that I'm going to use for my neck to figure out what's going on and where to start working for solutions. And then last, I'm going to go over the actual movements that I'm going to use to help my neck to feel better. And if you stick around to the end, I'll go over a bonus tip for you. It's Wednesday morning. I'm going to go to no-gi jiu-jitsu class. I woke up feeling stiff. Left side of my neck was sore. The day before, I had been carrying a bunch of equipment. I figured, normal situation, if you're feeling sore, one of the best things that you can do is to keep moving and resume training and doing things that feel normal to you. And that will actually help it improve. And so since it was a little bit of soreness, I went with the assumption that continuing to move, continuing to train and do things with my neck would be a good thing to do. So I went to class. During warm-ups, when we were doing like kind of somersault rolling drills, my neck could really feel it. I thought, well, I'm just going to keep going. Maybe this will feel better. Then we're doing drills with partners, and we're doing a lot of things that involve chokes with head and arms and kind of pulling. And I knew that I had made the wrong call at this point, but I'm already in it. So I'm going to keep going and try to navigate through it as best I can. Got through class, worse, not terrible, doesn't feel good. Particularly driving, trying to like turn and look in my blind spot, that doesn't feel great. Under most normal circumstances, I would recommend that people continue to do the things that they enjoy doing. If it were weightlifting or if it were running and you're feeling a little sore, kind of a nagging thing, making sure you warm up, making sure you address that, continuing to do the training that you normally like to do and participate in whatever activities that it is that you like. If things start to feel worse, modify the activity. In my situation, I was able to change the direction that we were working and just had the partner train on the other side, so it wasn't targeting the problem side of my neck as much. And then at the end of class, instead of staying and kind of grappling and having rounds with some of my teammates, I ended up just leaving. I don't need to make this worse than it is. I was able to modify the activities a bit and continue to participate. And under normal circumstances, I would say do the exact same thing. However, because we were training things with the neck, that wasn't great, and now my neck is paying for it. I'm going to take you through the assessment process that I'm going to use for my neck to figure out what's going on, give me some direction on where the solutions may be. So right now I know it's the left side of my neck, kind of on the base, near the shoulder, up into the back of my neck, kind of following here and up this way. The first thing that I'm going to do is take a look at my neck range of motion. So I'm going to start by just turning my head. That doesn't feel so good. Primarily right here at the base of my neck. Then I compare to see how it feels going the other way. That actually feels better, and I feel like I can move further. Next, I'm going to look at closing that joint down, more specifically with a side bend. That feels like a pull on the left, but the right feels okay. That feels more compressive, irritating kind of in the joint. So I can tell something with the neck as far as how it's moving. Kind of at the lower part of my neck, I'm thinking C5, C6, just diffusely based on where that pain is feeling. From there, I'm going to take a look at how my arms are contributing to this. So I'm just going to feel around first, so kind of feeling in there. This is tight from the shoulder blade up into my neck. This is kind of the levator muscle area. Feeling on this side, I can feel the connection to my first rib with the scalenes is very tight. That's going to affect T1, which will set the foundation for C7 and C6 to be operating, can be contributing there. The other thing I notice at rest is I'm feeling around. If I feel from the bottom, this inferior angle of my scapula seems to be pulled away from my rib cage a little bit. And if I feel coracoid process, pec minor definitely feels tighter on the left than the right. What I'll look at next is how my overhead movement feels. So if I'm just feeling here, uninvolved side, that feels good. The involved side starts to irritate a little and doesn't feel as comfortable at the top of the range. So next what I'll do is I'll take a look at internal and external rotation of the shoulder, just using some bony landmarks. using my right hand first, working my way down, got there. This feels a lot tighter, and it feels like I'm kind of elevating, looking at internal rotation. Right side, I can get to the inferior angle of the scapula and up a little higher. Left side, inferior angle of the scapula and not as high. Still feels fairly decent. Okay, so I can feel a lot of tension in here. My hunch, given my typical issues, is that serratus is probably not contributing as much as it should be. Next, I'm going to check the thoracic rotation. Oftentimes that kind of sets things in motion for me as well. From here, I'm going to check some thoracic rotation. Oftentimes, I'm a little more limited with the extension rotation pattern going to my left. So we'll take a look here. Simple screening test that I use. I go hands and knees, elbows to my knees. And then what I'm going to do is take the hand that I'm checking, put it behind my neck, keeping this down, try to rotate. Repeat on the left. That feels a lot tighter. Typically in this scenario, for myself, it feels as though I'm not rotating as far to the left, and my serratus often feels like it is not engaging as well, which in part would be why I compensate with the elevation, pairing that with the day before, having done a lot of carrying things on my shoulders and trying to elevate and lift with my shoulders. My hunch is I just overdid it, and then that combination of my usual areas that I kind of flare up in moments like that, that's probably what's driving this. So we'll take a look at now, how do I address that? The first thing that I want to do is start to get this levator muscle to not be pulling in this direction as much, because that is really annoying me. And to be honest, that's probably the most annoying piece of this. Turning my head I can kind of deal with, but that tight muscle really bothers me a lot. So what I want to do is create a movement that moves that shoulder blade in the opposite direction. So one of the things that that muscle is doing is it's trying to pull this up. So what I want to do is create, instead of this rotation in this direction, I want to create the opposite rotation. To do that, I'm going to hold my hand out like I'm hitchhiking, and then what I'm going to do is try to drive my shoulder down, my elbow out, and my thumb back. So I create this motion. What I find is this active working against this softens this up right away, and immediately after just a few repetitions, I feel some relief in that tension. From there, I want to expose the joints of my neck to the motion that they're tending to not like very much, which is a rotation to the left and an extension, which compresses that joint. It slides everything down and back. That irritation is now sensitized, and my brain is saying, don't do this, this is a threat. I want to retrain that and give my brain the experience of this is actually okay, and then rehabituate and then just get back to my normal training. So to do that, counterintuitively, I'm going to move the direction that things hurt, but I'm going to give myself some external support so my brain trusts it a little bit more. What I like to do is get low on my neck down here on both sides. I'm going to pull down and forward a little bit to create a sense of stability. The next thing that I'm going to do is I'm going to turn that direction. I can add overpressure if I so desire by pulling this right side around, because I want the vertebrae to twist and extend. So I can do this. I can pull down here and push up and around, and I can kind of help this and just repeat. From there, I can also look up, like kind of pulling and supporting. And you'll find that when your hands are here supporting things, it feels a lot easier to do a full range of motion, as opposed to if I don't support that, there's almost like a muscle guarding trepidation. My brain does not trust my joints and muscles to support that motion right now. As I build up, I want to do that without that support, and then hopefully it feels better. And then I can even combine the motions. So supporting here, turning and looking up, and really trying to get my brain used to that feeling again. Additionally, once I get my neck rotating a little bit better, What I want to do throughout the day is try to strengthen this retraction motion and just drawing my chin straight back. I don't want to look down. I don't want to look up. I want to go straight in. Almost as if imagining a string where pulling my posture up and just trying to draw that in. That alone is not going to fix anything, but it's going to prime that motion a little bit better. So hopefully I can feel a little bit better as I'm starting to move. If I'm starting out here and I try to rotate, I don't have as much room to rotate. Chin tucks in and of themselves are not going to fix anything. The other thing I'm going to need to work on is getting my serratus anterior muscle to help control for the upward rotation of my shoulder as I start doing things. This is another piece tied with the thoracic rotation that is really driving a lot of this for me. It's a common thing that I've run into in the past. What I'm going to do next is I'll go down on the floor and show you how I do that. This exercise is fairly straightforward. I find a lot of relief when something like this is bothering me. I'm going to be laying on my stomach just with my hands propped up on my elbows. And what I'm going to do is I'm going to drive my elbows down and through as if I'm trying to push away from the floor. And so it'll look like this. Just trying to get up and away. Like I'm trying to get my chest as far away from the ground as I can. From there, what I'm going to do is start moving my neck. I find that this usually helps quite a bit. So I push up and away, and then I start turning my neck. In the motions that things have been bothering me. Similar to what we were doing before, it addresses the sensitized part of my neck where my brain thinks it needs to protect everything, and it gets the experience that this isn't so painful because it's now supported by the control of the serratus muscle doing what it's supposed to. This is not the primary way to train the serratus muscle. It is a way to relieve some of the tension and irritation in the neck. Moving forward, I'll need to do different things for the serratus muscle. While I'm down here, I'm still going to hit some of the thoracic rotation in the same way that I was doing before. Part of the reason why I like to be down kind of this hands and knees position is it locks my low back. If I'm up a little higher and I do the same rotation, it's going to feel like I can go a lot more because my low back is not locked out. When I sit my butt back on my heels, rounds my low back, and now I can't use my low back for that rotation. So similarly, when I'm here, let that low back round, and then I hit this rotation. There are lots of other ways to get this rotation. One way that I like to do is when I'm in my chair. What I want to have is my shoulder blades protracted. So I'll show you that right now. A way you can practice rotating your mid-back or your thoracic spine during the day, in the way that I'm going to be doing it, is using a way to incorporate breathing with the motion. If I just passively do some stretches, maybe I do a foam roller or bend over something or create a passive extension through my mid-back, I'm going to be relying on that passive component instead of actively controlling it. A lot of the issues with my neck and my shoulder, my mid-back, as well as for most people, it's rooted in their inability to control the motion themselves. Once you can learn how to re-control that motion, then you usually don't have those issues popping up as often. So what I'm going to do here, I'm going to use foam roller because I have it, and I'm also going to use a big ball because I have it. If you don't have it, you don't need it, so I'll show you both. But what I'll do is I'm going to keep my knees in place. I'm going to try to hug around this ball as much as I can. The reason is if I don't, my shoulder blade is back. But the more I reach, the more I protract my shoulder blade. From here, I'm going to try to rotate to my left. And what will happen if I don't watch for it, if you watch my left knee here, if I allow it, my left knee is going to rotate back as I rotate. I don't want that. So I'm using this foam roller as a cue to try and roll my left knee forward as I rotate. From here, I'm going to take a big breath. Try to rotate more on the exhale. Let's say I'm somewhere today where I don't have all that equipment. I'll be driving, so I can do this in the car, if I'm at a stoplight or something. What I'll do is I will just bring my knees together. Having my knees together gives me a similar cue. If I don't have the big ball because I'm in the car, what I'm going to do, the side that I'm focusing on, I'm rotating that way, I'm going to reach that arm across, and then I'm going to use this one to kind of help pull, keep my shoulder blade out in front as much as I can. From here, I'm going to rotate. I'm avoiding tipping to try to get more motion. It's a really common thing. So I see a lot of people, what they'll do is they'll rotate and then they get here and they start tipping to the side. It's not the worst thing you can do, it is just not focused. So I'm going to be very conscientious to just be spinning like a top as I try to create more of that rotation. By addressing what's going on in my neck, some of the symptoms, trying to manage some of the muscle tightness, and then recreating some strength through the serratus, getting some motion to desensitize some of the guarding going on, and then improving the motion in my mid-back. Within a day, I'll probably be feeling significantly better. Within a few days, I probably won't even notice that this was even flared up. I'm going to continue training. I have training in another couple days, so I'll just go to that. If things flare up again, it's probably something more serious, but if I can calm the symptoms down, resume my activities without even having to really modify them, then this worked out perfectly. If something's flaring up every time that you do the activity you like, whether it's training jiu-jitsu, weightlifting, running, playing a sport, and when you take time off, it goes away and calms down, and then you resume whatever it is that you like again, and it comes right back, it might not be that you have an injury, but that you have a pattern, something going on with the way that you move. And the real work is just figuring out what that is. For me, it was the rotation in my mid-back and the control of my shoulder blade, and that was driving my neck pain. So if I would have just done things for my neck, I wouldn't have really done it. So if you've got something that you've been dealing with for a long time, or every time you do what you like, it comes back and you just can't figure out what's going on, the link's in the description for a free call. The bonus is today at Jiu-Jitsu, I warmed up the same way I was doing the treatment stuff. It was all fine. So I did the same thing. So I looked up, looked left, looked up and left, and then I did cars for my neck, controlled articular rotations. So I did a turn, tip, look up and around, turn, tip, look up and around. Just warm the neck up that way. For the arms, I did the same kind of things. Since I'm going to be using it, I want to do ballistic movements. I don't want long hold static stretch. Some basic movements, up, back, up, back. The other thing that I'm going to do is the same kind of hitchhiker drill I was doing. See if I can warm it up, tip away, roll. Same warm-ups I was doing before. And then lastly, I'm going to do shoulder cars. Same thing I'm going to do for my neck. So I'm going to do a big rotation, give my rotator cuff the warm-up that it wants. Beyond that, it's going to be the same jiu-jitsu warm-up that I do all the time. Forward rolls, backward rolls, shrimps, that kind of stuff. Sport specific. If you're doing other things, do sport specific warm-ups.